This episode of Doc Talk is brought to you by First Bank. We're not just your neighborhood bank, we're your neighbors. Our local team lives up to the name, putting our customers and community first. To experience First Bank difference, stop by any of our 13 Knoxville area locations or visit firstbankonline.com. First Bank, member FDIC.
Hello, my name is Dr. Rob Page and welcome to Doc Talk. Doc Talk is a podcast that is produced by the Knoxville Academy of Medicine, and it features its member physicians giving information to patients that are useful, topical, and helpful in terms of being able to guide their healthcare decisions. And I'm fortunate to have with me today Dr. Ryan Dabbs. Dr. Dabbs is an orthopedic surgeon here at TOC at Park West, and he is here to talk to us about joint replacement. Welcome, Dr. Dabbs.
Thank you. Glad to do it.
So when we talk about joint replacement, particular types of joint replacement that you do, you mentioned when we were discussing beforehand about hip replacement and knee replacement. Are there, and I think a lot of the patients know about knee replacement, but are there any novel approaches or any better things that we can provide for patients now that you specifically can do in your clinic?
Yeah, I think the cutting edge instrumentation we use is part of the robotic knee replacements and robotic hip replacements. The robotic instrumentation is a tool we use to help us put the knee replacement in or the hip replacement in as perfect as it can be done.
So now, how is robotic assisted surgery? How is that helpful for you in terms of being able to provide something better for patients?
And I think you said it right. It's robotic assisted surgery.
That's right.
The robot's just assisting, but it is just a tool. The robot arm comes in and helps line up the cuts that we make in the surgery and makes those cuts as perfect as they can be. I still use the instrumentation and do the surgery, so it is just lining up all of the cuts, and all the cuts are usually based on a template that we did before surgery, based on the patient's arthritis type, their deformity type, their age and bone quality. All goes into how we decide on what kind of knee or hip replacement to do, and that's what the part of the robotic assisted surgery that helps.
So essentially it eliminates any wasted motions, any wasted cuts, anything that might cause an increase in recovery time. You basically get all that, you've got that down to a science where you do very few wasted motions and very few, basically limit as much motion as possible in the joint.
Yeah, that's right. And I think the idea is long term, if the knee replacement or hip replacement is as perfect as it can be, it will last longer. And so the patient's long-term satisfaction, this should be their one and done surgery for the rest of their life. If there's a little bit of malalignment or the cut is off 1 millimeter, we think that may wear out sooner. They may have earlier failure, and so this is mainly long-term. If it's perfect, it should last the rest of their life.
So essentially to provide it as exact as possible so that there's very little chance that they might have to go back in the future and be able to have it done.
That's right.
So what sort of patient is eligible for this surgery? Is there a certain age that's eligible? Is there a certain type of patient? How would I've got knee pain. How should I go about being evaluated to determine whether or not I need a knee replacement?
Yeah. Anyone who has bad knee arthritis or bad hip arthritis can have a robotic hip or knee surgery. So the age and their functional status doesn't matter as far as whether they can have the robotic part. But certainly they need to be evaluated by an orthopedic surgeon to see if they're a candidate based on how bad their arthritis is.
So, so you get evaluated beforehand. Would that be by an orthopedic surgeon, or would I, generally go to my primary care doctor and have them work me up, or what? How does that generally work out?
So, yeah, most people see their primary care doctor first, and most aches and pains of the hip and knee can be treated conservatively. So most people end up with a course of an anti-inflammatory, may have a shot, may do some physical therapy, which are all good things that may take care of their problem before they need to see an orthopedic surgeon.
Okay.
But then once that's failed, that's when most people see me and we go through the surgical discussion.
So I come to your clinic, I get evaluated, it's determined that I need a knee replacement. What are we talking about in terms of the time frame? How long before I can get the surgery? Does insurance pay for it? And what would I expect my recovery time to be? And when could I get back to a normal lifestyle?
Yeah, most people have insurance that covers the knee replacement because it's considered a medically necessary procedure once they have checked all those boxes. They've failed the conservative treatment for a period of time, nothing else is helping, and it's a severe arthritis. Then insurance covers it, and usually it takes a few weeks to get scheduled for surgery. There are a few different types of robotic knee replacements, some that have a longer leeway where you need a CT scan and they have to create custom parts to the knee replacement. That takes a little longer. That's in the 8-week range. Gotcha. Versus non-CT based robotic surgery, which can be done right away as soon as insurance and all the medical preoperative testing is done, and that's usually just a few weeks.
Gotcha. And then, so I have the surgery. How long does the surgery itself generally take?
Most surgeries are about an hour.
About an hour. And then, and then after that, would this be? Do I have to spend time in the hospital? Do I have to stay there overnight, or?
That's the biggest advance too that comes along with the robotic knee replacement. Is we're doing almost all of these surgeries as outpatient.
Oh, wow.
So unless somebody has a significant medical comorbidity that they have to stay overnight because we're worried about their lungs or heart function after surgery, almost everybody goes home. And that's really opened up outpatient surgery at the surgery center as well. And so we do a lot of these surgeries now, hip and knee replacements, actually at the surgery center, so the patient doesn't even have to go to the hospital at all.
Wow, that's incredible. And so not only do I not have to spend any time in the hospital, I can do this all as an outpatient. And what would I expect the recovery time to be afterwards? Are there certain things I need to do post-operatively to, basically help me in terms of my own recovery? How should I approach this as a patient? If I'm thinking to myself, this is something I need to have done, and I need to maybe schedule some time off, or maybe I'm thinking about work, what sort of plans do I need to make?
Yeah, most people, 6 weeks and most of their recovery is done. So I tell most people to expect 6 weeks or so off of work, and that depends on how physically demanding their job is, but most of the time 6 weeks is all they need and they're done with physical therapy. But that's the most important thing they can do after surgery is work with physical therapy. That speeds up recovery, lessens the chance of having a complication like stiffness, weakness, muscle problems that are related to the surgery. And then by 6 weeks, most people are done with therapy and are ready to get back to work. There's still recovery and still changes that happen up to a year, but about 90% of the recovery is done in that 6 weeks, and the final 10% may take another year, but certainly those are things they can work on their own, back at work and back to semi-normal lifestyle.
And the physical therapy is the most important part, right, in terms of that recovery?
That is, especially for the knee replacement. The knee replacement is really
important. Now,
is
physical therapy something else that you provide through Tennessee Orthopedic Clinic as well? Would this be something that I would, so I would basically be able to have my physical therapy done there as well?
Yeah, yes it is, but people come from all over the state to come and have their surgery done here, and so they can certainly do physical therapy back in their hometown.
Gotcha.
Most of this therapy is therapy that any certified physical therapist can do. We do provide that, so for local people in Knoxville, it's nice to keep it all in-house so we can monitor their progress. But for people who live in outlying cities, we're happy for them to do it there. It makes it a lot more convenient.
Wow, so that's incredible. So if I'm, so if I'm down in Madisonville and I can just drive to Knoxville for the day, I get the surgery, I've driven home that day. If I had somebody else drive me, hopefully.
Yes,
I was going to say I'm not going to drive myself home, but have somebody else drive me home. And then after that, I would get my physical therapy there and then be able to, not have to drive back and forth and back and forth. So that's great. I see you brought something here today to show us, and I want to see this example.
This is the model of the knee replacement. And I think a good way to think about it is really a resurfacing of the knee joint. And so the metal pieces really cap onto the end of the bone. It really resurfaces the end of the femur. And there's a tray on the top of the tibia. It's really a resurfacing of the tibial portion of the joint, and then a plastic piece in between. And that's the modular piece that we can adjust up and down, different constraint options depending on the patient's anatomy and their ligament status. So most knee replacements still require the patient's own ligaments to be intact. That gives it a more stable knee. But if somebody has a really advanced arthritis, has torn or stretched out their ligaments, we can do a different type of knee replacement that takes that into account. So I think this is just a good way to look at it, and this helps people visualize. It's really a resurfacing. A lot of people picture just cutting a big chunk of the bone away, but it's really a small sliver, and that's the part that the robotic arm assisted helps with. All of these cuts are so precise that it just works better for the patient.
Right. So yeah, and exactly what I was thinking is that, I think just as a patient, you would think that, well, you come in and you cut, the femur, and then you cut the tib fib, and then essentially you would put an entire metal piece in there, but you're not doing that at all.
Yeah.
You're actually just putting metal pieces in on the surfaces of the
That's
joints.
right. The whole goal is to be as minimally invasive to the bone as possible. So the more bone that we can preserve, the less invasive it is, the less recovery time, the less pain people have. And then the preservation of their own structure, so their own ligaments that attach to the bone, so the knee just feels more natural.
Wow, that's incredible, because I think I think that to me is the one. I've never seen one, to be quite honest. I'm not, me, I'm a pathologist. We don't see these things very often, but that's incredible to see that in terms of how. And then the kneecap that actually stays in place on top of that.
Yeah, the kneecap sits on the front of the femoral component, so there's a groove built in. Most people have the kneecap resurfaced as well.
Okay.
So the back side of the kneecap has a piece of plastic put in place so that it'll glide perfectly on line with the femur piece. If there's no arthritis on the kneecap, then it doesn't have to be replaced.
Okay.
So that's one less step if you don't have to, but everyone has arthritis in all parts of the knee.
Wow. That's incredible. And what is the average age of your patient? What typically is the age group that you're looking at?
Yeah, most of the time it's a 65-year-old patient who has been dealing with this for years and has reached that point towards the end of their career where they're ready to have the knee replacement. But we're seeing younger and younger people now, and they're people who have old injuries and have a bad post-traumatic arthritis, and people are more demanding on their body now, so people may want to continue to play tennis and play golf and sports into their late 60s, 70s, and so we're doing more and more knee replacements and hip replacements on younger and younger people, and we expect them to last longer with the new materials that we're putting in.
Wow. So legitimately, I could be fully active, go back to doing, if I'm a very active person before I had the arthritis, I can essentially go back to being that active person again, which, which again, being active, as we well know, is part of, the important part of actually staying young.
Yes.
Keeping your mind young and keeping your, keeping weight off and making sure you avoid a lot of the other things. So, well, let's say I've got arthritis in both knees. Would I be able to get both knees replaced at the same time, or how does that generally work?
So both knees at the same time is not recommended.
Okay.
There's a lot of studies lately that have come out that both knees at the same time have increased complications. So we try to focus on one knee and then do the other at a time point later, usually around 3 months after the first knee. Some people have really bad deformities, and so if both knees are really crooked, then we can do them both at the same time, because they'll have a hard time recovering with one knee still crooked and the other knee straight. So that's the only exception, is if both knees are really crooked, you can have them done. Otherwise, one at a time. Now that's different than hip replacement. Most hip replacements can be done at the same time on both sides with the front approach to the hip. That makes that more doable, and the blood loss recovery is much less for the hip replacement than the knee. So I do a lot of bilateral hip replacements.
Now talk to us. Now we've talked a lot about knee replacements. Talk to us a bit. Do you have any examples of a hip here that with? I was going to say. I was going to say bring the hip over here too. I was going to say I'm going to say I like.
Yeah, the models are helpful.
I like examples. So we talked a lot about knees, and I think that a lot of the older people are very familiar with hip replacements. And in terms of a lot of older people we know coming with they get the head of the femur fractured. They come in with a fracture, and they have to get they're basically the hip joint replacement. But talk to us about the hip joint and how that and how your form of surgical intervention varies from just the typical type.
Yeah. So the newest way to do the hip replacement, it's really an old way to do it, but we have new techniques, new instruments to do it better, is the anterior minimally invasive way to get into the hip. The actual part of the hip replacement, the materials are newer, so the ceramic metal pieces that we use and the plastic that actually forms the hip, so it's a ball and socket, and that's why it works so well, is it's easy to recreate a ball and socket, and people do really well with that. But it's how you get into the hip to do the replacement part that matters. So if we can avoid cutting and disrupting the muscles and the tendons around the hip, then the recovery is much better. There's much less complication rate of dislocation, less pain, quicker recovery with a minimally invasive hip approach.
And the minimally invasive, that's done via, that's robotically, correct?
So the robot part is not minimally invasive.
Okay.
Minimally invasive just means we're getting in there without disrupting the muscles and the tendons. Gotcha. The robotic part just helps place the cup in a certain position, helps place the stem in a certain position. It doesn't add as much to the hip as it does to the knee, but the approach, I think, is what matters. So a lot of people have had other approaches to the side of the hip, to the back of the hip, and those have worked well for a long time, but they're a little more invasive than the front approach.
Oh, wow.
And so,
and you had mentioned also when you were talking about the knee replacement, this is something you can also do as an outpatient?
yeah, and actually people do better with hip replacement outpatient than knee. It's a little less painful, a little less traumatic. So people are walking out hours after surgery and going home almost every time after a hip replacement.
Wow.
So it is definitely outpatient surgery almost every time.
And that's something that's really transformed over the last few years.
That's a big difference. The way we do it, and then the rapid recovery protocols we have. So the pain medicine regimen, the type of anesthesia, the local injection of numbing medicine all makes that possible. So people are up moving much, much quicker.
Oh, that's incredible. And you also mentioned that even as an outpatient, if I had problems with both hips, I could get both hips replaced as an outpatient?
That's right. That's a new thing. That used to be you had to have them both done as an inpatient, but that's coming around to outpatient as possible. And certainly any surgery we do, as long as the patient's doing okay post-operatively and there's no restrictions, they can go home as soon as they're up moving around. Most people pass PT a few hours after surgery and can go home. If they have
when you say pass PT, you mean?
Yes, the physical therapist come and work with the patient
and
make sure that they're safe to walk around and could get around safely at home. That's the biggest hurdle, is making sure they're doing that, and then they can go home right away.
That's incredible. So just unbelievable, because that's something that really must have, I mean, since granted I was as a pathologist, not something I get a lot of exposure to, but I remember it being a lot more involved when I was, when I was a resident and a lot younger, even 15, 20 years ago.
Yeah,
so.
They would keep you in the hospital for a week after a hip replacement years ago until they felt safe to go. So a lot has changed, and that's for the better.
That's incredible. So, well, now tell us about your clinic. You told us you work. You told us. I said actually you work at Park West. You're with Orthopedic Clinic. Tell us about your practice there.
Yeah, at Tennessee Orthopedic Clinic at the Park West location. So I focus mainly on joint replacement. So that's hip, knees, and shoulders. And so I have a clinic there at the Park West, do almost all surgeries at Park West location, and then we have a surgery center at the Park West location too, where most of the outpatient surgeries are done.
So located right there in West Knoxville, very easy too. Now, is there a website that I can go to get additional information if I'm interested in sort of doing some research on this?
Yeah, the Tennessee Orthopedic Clinic website is tocdocs.com. So tocdocs.com.
We'll put that down on the bottom of the screen so people can get that. And is there a phone number they also can call?
Yeah, so 690-4861 is the phone number to call for scheduling. Okay. And so the website, you can do an appointment on the actual website or make a phone call.
Well, that's incredible. That is all new information to me, and that's incredible stuff that you guys are doing now in terms of that replacement. So, because it's now I don't feel so bad about maybe getting mine in a few years.
It's not so bad. When you have to do it, it works great. This is one of the best surgeries that we do now.
That's incredible. So, well, thank you so much for joining us here today. You've given us some really valuable information. Yeah. And with that concludes this episode of Doc Talk. Doc Talk is a podcast that's produced by the Knoxville Academy of Medicine and features its members' physicians like Dr. Dabbs here, giving information to patients that are really useful in terms of how they approach their health care. I'm Dr. Rob Page, and thank you for joining us.
This episode of Doc Talk is brought to you by First Bank. We're not just your neighborhood bank, we're your neighbors. Our local team lives up to the name, putting our customers and community first. To experience First Bank difference, stop by any of our 13 Knoxville area locations or visit firstbankonline.com. First Bank, member FDIC.